All right. Well, we'll go ahead and get started. So welcome guys to, I think this is Journal Club number 23 of the CALU Journal Clubs. And if you don't have the paper, I'll drop that in the chat in a minute. But Kevin is going to lead tonight's discussion, and we'll kind of just see where it takes us. We have a smaller group, so probably won't need to do breakout rooms or anything, but there's a couple of options as far as participation. Feel free, again, since it's a smaller group, to kind of just jump in wherever. Or you can always use the raise your hand feature, or you can use the chat to have a conversation, or also type your question, comment there. If you are not talking, or you did speak and now you're not speaking, don't forget to mute yourself, just so we don't have a lot of background noise going on, because we do record these in case people are not able to attend the live version. So with that said, Kevin, take it away.
All right, I will. Thank you, Megan. And thanks everybody for joining me tonight. I'm going to try to do my best to keep this as smooth and as entertaining as possible. But biggest thing I want is lots of input from everybody else. So the paper we're going to discuss today is from American Journal of Sports Medicine. And this was published in, I believe it was February or March of last year, so 2021. This was from Enda King's group out of the Sports Surgery Clinic in Dublin, Ireland. And this paper really caught my eye, one, because it's a prospective study. So those are always kind of interesting, especially when we're having data coming through the rehabilitation process to kind of reflect back on. But essentially, the title really caught my eye because it was looking at biomechanical, but not strength or performance measures differentiate male athletes who experience ACL Reinjury on a return to level 1 sports. This was a pre-registered trial, and essentially what I wanted to do is I'll just kind of give a little bit of a rundown on some of the details of the study, some of the things that they were looking at, and then kind of what their findings were. I'll give a little brief kind of statement on what my impression was, some of the things that I liked about the study, some of the things that I thought maybe just left me with a couple questions, and then we'll kind of go from there unless anybody has anything else or a different format they'd like to go. Otherwise, I'll just kind of start rolling with it, okay? All right, perfect. So first thing I will say that I really liked about this study is they were asking a pretty specific question, I would say. And oftentimes I do kind of wonder if we are a little too vague or a little bit too wide in the questions that we're asking. Does that maybe not influence in a negative way some of the conclusions that we're able to make from a certain degree of, or from a paper specifically? So this paper was nice in the sense that they had a pretty large cohort initially that they started with. So it was over 1,000 athletes that had ACL reconstruction done by the same 2 surgeons, and they were specifically looking at male athletes. So there was a little bit of some back and forth with some letters to the editor in response regarding this paper, and one that was published around that time regarding some of the I guess nuances of the paper, but they were specifically looking at male athletes, and they were looking at those that returned to only a level 1 sport. So we're thinking multi-directional field sport athletes with this one here. And the real important one with this paper is they were specifically looking at re-injury to the ACL reconstructed limb. So they did do another paper with the same kind of cohort that was looking at contralateral injury. But for the paper that we're discussing today, they were looking at, did you go on to re-tear your ACL that was surgically reconstructed? So I think that's an important one to keep in mind. Essentially what they found was that there was 31 re-injuries, or excuse me, 38, 7 were lost to follow-up. So they had data on 31 individuals that were reconstructed at the sports surgery clinic and went on to tear their reconstructed limb. And this was also matched, to their credit, with 57 individuals who did not rupture their reconstructed limb. And that was matched with time from surgery to return to play. They did a good job matching for age, as well as graft selection. So between patellar tendon and hamstring tendon, they matched those that retore versus those that did not with their graft selection as well. what they did was they had a follow-up at the 1 year and the 2 year mark where they essentially just communicate with the individuals. Are you playing? Did you tear? Did you not? And they reflected back using data from their testing at the 6 month and the 9 month mark. Although I think there was a little bit of confusion on my end on what exactly they were looking at for a lot of their conclusions. I believe it was the 9 month mark. But they looked at a number of different things. So they looked at the double leg drop jump and the single leg drop jump performance. So just for clarification on that, the drop jump is more specifically looking at ground contact times and how quickly someone can go from an eccentric to a concentric contraction versus a depth jump, which would be something looking at height on that second jump. So that's an important thing to keep in mind. They also looked at single leg counter movement jump for height on that and single leg hop for distance. They additionally looked at 3D analysis for the double leg drop jump, the single leg drop jump, as well as a 90-degree planned and an unplanned change of direction. And then for force measures, they were looking at concentric, and I say that specifically because there's some things I want to touch on that later in the paper. They looked at concentric force production for the quadriceps and the hamstrings at 60 degrees per second. There was no mention of any sort of eccentric assessment or increasing speeds in degrees per second for their isokinetic measures. On the 3D analysis, they looked at basically motion of the center of mass from the distance of the center of mass to the ankle and the knee in all 3 planes. They also looked at kinetic variables, which are ground reaction force relative to body mass, and then stiffness measures as well, which again is kind of that time from initial contact to the end of the eccentric phase. So looking at the plyometric ability of these individuals. So what did they find? Well, they found that, like I said, that 31 went on to re-rupture their surgically repaired side versus 58 that did not. So there was a lot of variables that they were looking at here, which what I would say is not a ton of subjects for the number of things that they were looking at, but they mentioned that in some of the limitations where they tried to do their best to use, I guess, means or kind of averages to kind of balance that out a little bit. But a lot of outcomes they're looking at for not a ton of subjects. So you got to wonder, is probably going to be bound to find something. But all that aside, they found no difference in patient-reported outcome measures. So they looked at the MARC scale, they looked at an IKDC, and then an ACLRSI. So no real information from patient-reported outcomes that would suggest one way or another if an individual was going to re-tear or not. They found no difference in change of direction time performance between sides. They found that there was no significant differences in terms of 90% LSIs for the isokinetic data, except for the hamstring, where they found that 45% of those in the injury group failed to meet that hamstring isokinetic concentric measure of 90%. In the double leg drop jump, this was kind of one of the main things that they found in addition to some of the change of direction work from the 3D motion analysis. They found that there was increased knee flexion, increased ground contact time, and a lower relative center of mass. So you can just kind of imagine these individuals on the double leg drop jump were landing in deeper knee flexion, spending more time on the ground in the group that went on to re-tear. And then in the planned change of direction, there was a decrease in posterior direction of the center of mass behind the knee in the group that went on to tear versus those that did not. So essentially what they found was that I do think one thing I will touch on is the title of the paper was a bit sensationalist for kind of what they wound up finding. They later go on to say in the later portion of the paper that there was poor predictive value in terms of using 3D motion analysis to predict future injury, but it's something that you may want to additionally look at to reduce risk. So kind of keep that in mind. But in their kind of conclusion of the paper, they found that overall, measures of double leg drop jump and unplanned change of direction were identified, although they had limited ability to predict future injury. But that was kind of the 2 main objective pieces that they looked at from a testing perspective that had a very weak correlation with kind of a fair effect size to predict those. I shouldn't even say predict. That was shown in those that went on to rupture their surgically repaired side. So I think I'll mention a couple things and then I'm going to stop talking, but there's a few things that I had questions about in this paper that I would like to hear you guys' thoughts on. Is one, even though they didn't have any meaningful deficits in their force production observed isokinetically, they did not look at eccentric capacities for this here. And judging off of some of the 3D motion analysis stuff, you can kind of start to link together. They're presenting as though they have strategies, or they're presenting with strategies that are suggestive of some sort of quad deficit, I would say, especially eccentrically, and then also deficits in rate of force development. So even though something in like the double leg drop jump was, I guess, symmetrical in terms of height, you could see that they used a longer time on the ground to complete that in the group that went on to re-injure. So my biggest takeaway from this paper was the fact that I don't think we can say that there is more credence that should be given to 3D motion analysis when we're looking at strategies that may be suggestive of actually eccentric deficits from a force production standpoint, as well as rate deficits. So in my mind, they didn't do a good enough job at kind of ruling out the potential that there's lingering quadriceps deficits in rate and in eccentric capacity to suggest that that was not an influence, and this was purely a biomechanical or a movement strategy related deficit that contributed to the potential for re-injury of their reconstructed limb. So that's what I got. Everyone else, what do you think? Agree, disagree? What stood out to you guys with this paper? And let's kind of open it up.
Did you find their re-tear rate to be a little low based off of what we know statistically? They were at like 3 or 4%.
I was gonna say, like, I actually like commend them for like having like such a low re-tear rate. And then like I even went and I looked at the other paper where it was like combined with the contralateral. And I think even across like that cohort of, I think it was like 1095, 1,000 ACL reconstructions, they were in like the 9% for the re-tear rate. So they're doing something right. I mean, up to the 2-year mark. I think they're doing a 5-year prospective as well, which will be kind of interesting to see if that creeps up at all. But I did notice that their re-tear rate was low. So I think,
and their percentages for strength and some of these things weren't significantly different than what we would necessarily see. So what differences do we think that that population has? And I'm still not clear on what level 1 means. Is that recreational level? Because why say level 1 and then tell me that it's multi-directional sports? Why not just say multi-directional sports without any leveling bullshit thrown into it? So I'm not sure what that means.
Yeah, I think level 1 is, there's some sort of arbitrary classification on like what is defined as a level 1 sport. And my understanding of that is a level 1 sport is something that is, I remember seeing some graph on like what exactly qualifies it, but it's a multi-directional field-based sport is what I understand a level 1 sport to be. I don't think there's any distinction that is made between, whether this is at the professional level, whether it's the semi-professional or more the recreational level. It's like,
so we don't know what level of participation they're actually returning to.
Right.
So if they're a pro returning to recreational, they're still just saying that they're returning to that place. So they may not be returning to their pro level. So that doesn't tell me anything about that. It still seems to be a redundant statement to say level 1 and then go ahead and say multi-directional field-based sport.
Yeah, I don't know if that was just clarification on like the reader's part, but I think if we look at like table 2, they basically looked at, it was rugby, soccer. I don't know if that's hurling. I don't know what that is. Gaelic football was what they were monitoring.
Gaelic football is one of the top sports in Ireland.
Yeah. But I agree. Like, I think what a level 1 sport is, my understanding is that it's, like you said, it's maybe a little bit redundant, but I don't think there was any control for the performance level that was a return to, right? So like, obviously if someone's going down in a level of performance, maybe that influences their risk for re-tear if you're playing at a sub.
Well, it just makes it hard to know what we're returning somebody to, right? Because as a pro that's returning to recreational soccer, we would call that a swing and a miss, right? If our goal was trying to return them to that, even though they're back playing some recreational soccer, so there's some levelings that I would have liked to see broken out, especially if we're doing prospective. We could have chosen what we're going to do. And then I still look at the numbers and I looked at it. There's 10 between 2 surgeons. There's 1,045 ACLs. right? In a 2-year time span. If they're doing 2.5 days of surgery, that's basically 3.5 ACLs per day. And it's only on men. If we were to break that out and add women into that at the rates, they would be having to do 7 or 8 ACLs every day that they're in surgery. That just seems a little odd to me that we're at that rate and then we dropped all the way down to the 31 that we actually have data on.
Yeah, like I said, I think that's one of the things that like they looked at a lot of stuff for 31 re-injuries. So I think, you know, there's always going to be a degree with like statistics where like how much of this is kind of a spurious finding because you're looking at so many things with, you know, what looks like at first glance, you know, like a large population, you know, when you see like that 1095 number, but when you're really looking at, okay, so these are the number of individuals that actually retore their reconstructed limb. And these are all the things that we looked at. When it's 31 and there's what, 6, maybe more kind of things that we're looking at, I don't know, you start to put a little bit less stock in it through there, but like, that's not even like my biggest issue is like, based off of the phrasing of some of the questions around this paper, you know, suggesting that 3-dimensional analysis and, you know, the kinetics of movement is maybe a larger player into re-injury. I don't think you can say that because I can make a case for like, okay, this person still has eccentric deficits that are contributing to the strategies that they're using to complete these tasks.
Which seems odd that they didn't test those as well, right?
Exactly.
Unless they were going to say that it to them was going to be a redundancy and that we're doing some metrics that are physical movement things that are going to test that eccentrics. And so we didn't want to do that, but let's see if that's a strength deficit or if it's truly your biomechanical program. Let's really look at those things.
Exactly. And, you know, like, I think that's like my biggest gripe with this paper is like, to me, like this screams like they're just moving with someone who has an eccentric deficit or a rate deficit. Now, the one caveat with that is it shocked me that there was no differences noted in the single leg drop jump, but there were differences in the double leg drop jump. And I don't have an answer for that. You know, maybe somebody smarter than me or who has a good theory as to why that would be. Because in my mind, like I would feel like that degree of knee flexion and the dropping of the center of mass and the ground contact time would certainly, if it's longer in the double leg drop jump, then you're certainly going to see it in the single leg drop jump. So I don't really have a good answer as to why there seemed to be no difference among groups in that guy in specific. I don't know.
Jared?
I think
Jason, somebody, come on. Those
I
smarter
mean,
than us. Let's go.
I definitely don't have the answer for that. I would say that clinically, I see the single leg drop jump as one of the last things to resolve. That's like the reactive strength ratio from that is pretty difficult for somebody after an ACL reconstruction. I mean, that part of it makes me think of just like the way that they were testing, the way that they were queuing. Maybe they didn't get a great 100% effort out of some of those tests. So for some reason, I immediately think of user error because there's no other explanation.
Didn't they give them like a 30-second rest and we're looking for max effort on some of these things? And I think between some of these tests, there was a 30-second rest.
Yeah.
I can't remember what it was, but that seems a
can,
little short for somebody who hasn't necessarily been fully conditioned back. Perhaps they're doing a better job with all that since the reach error rate was so low, but I don't know.
You can never find out when somebody's dogging it on their strong side, and then it just looks symmetrical. I more had my hand up because table 4 doesn't make sense to me, and I don't know if I'm just reading something wrong, but the quadriceps newtons per kilogram, those numbers don't make any sense. It's not torque because it's not Newton meters per kilogram. So
yeah, good question with that.
I don't know what I'm looking at. Because then I don't know how to make sense of like how strong were their quads actually, because they're just giving force divided by their body weight.
That might be foot pounds.
It
Is that just talking about where you at?
Table 4, and then it just says quadriceps newtons per kilogram.
Oh, I see. Okay.
And it's like 198. So it's not torque. Well, it's not torque. It's not torque normalized to body weight. That's for sure.
Yeah, that's interesting because I think that they mentioned that normalized to body weight in here, but it's not displayed in, like, to your point, Jason, like that doesn't really normalize, like that's not peak torque to body weight. It's just a
No.
like, yeah.
Could it just be that it canceled out? Just with LSI, if they found, can you hear me?
Well, yeah, they have LSI on there too. Because if it's peak torque to body weight, it should be normalized. Like the number that we're looking at should be like 3 or like 2.5.
Yeah, it shouldn't be like, yeah.
Not 198.
So I mean, again, that just kind of gives more credence to the fact that, like, what are we really, if LSI is just the measure that you're looking at there, like that still doesn't rule out, you know, quad deficit contributing to the differences or the deficits that you're seeing on these other metrics.
Yeah, I'll look at that and I'll try to do a conversion later. But I want to say, because we'll get some numbers like that, if it's specifically looking at foot pounds, depending on the isokinetic dynamometry that you're using. So I think that is potentially what it is. But really quick, back to Jason, or maybe it was Jason or Kevin, which you were alluding to about the single leg drop jump and the double leg drop jump and the difference. So maybe that is, I know there's a paper that discusses not a drop jump, but just counter movement jump and a single leg jump, or technically a hop, and that the difference between those values, which maybe we can extrapolate to stepping off of a box, is that the counter movement jump is going to have a higher eccentric peak velocity. And so with a higher eccentric peak velocity, that means it's going to require a higher impulse to be able to decelerate your momentum due to the high eccentric peak velocity, because you have two limbs in contact with the ground, as opposed to the single leg jump that is going to have a lower eccentric peak velocity, but and you're just not getting as far down, simply because you don't have a strategy to offload the contralateral limb, but it might be more reflective of true peak torque or strength, maximum muscle strength, if you will, capacities. So the difference between those two is one is maybe more reflective of strength, the other is more reflective of your capacity to decelerate a high momentum. And so if you're basically now saying, okay, well, we'll do the same thing, but we're stepping off of a box, now the eccentric peak velocity is going to be even higher when you're stepping off and landing on 2 versus 1 foot. And so a person might have a stiffer strategy potentially if they're stepping off and doing a single leg drop jump, potentially. And then the last thing is, Kevin, I definitely agree with what you opened up with in regards to the paper is okay, but it just doesn't do a good job at really dissecting out the underlying derivatives of impulse, right? So it's like, okay, well, what is the actual strategy that manifested as this person's output? Because all it really looked at is what we would call conventional outputs or performance outputs, which is basically just jump height. But those don't really give you an idea of the strategy that somebody deployed in order to achieve said performance output. So for example, if we look at jump height, as Kevin alluded to, there can be a lot of different variants in how somebody organizes to do that, just simply because there's a lot of redundancy in the body. So all they're doing is manipulating the variables of impulse, which is force and time. So they're really manipulating the time aspect, and that's inherently going to change the force requirements. And so if you only look at jump height, you say, oh, their jump height's great. Or if you look at single leg horizontal jumps and you say, okay, well, their distance is the same, but again, they could be having alternative strategies, and maybe they're staying in contact with the ground for longer in order to demonstrate the impulse needed to propel themselves forward, to have a horizontal or vertical momentum. And so I think maybe that was one of the flaws within this study, because it makes you think, oh, well, we need to maybe have different interventions to have a restitution in some of these qualities, whereas, well, maybe we actually just didn't resolve the kinetic capacities and as a result, it manifests as kinetic strategies that might not be that conducive. So I think that's the big thing to kind of really be wary of, and understanding like the physics behind some of these manifestations, and not just looking at the performance of, oh, this is their jump height, or oh, this is their distance that they achieve. Because again, there's just so much redundancies and so many solutions that people can deploy, and sometimes they're imperceptible to our eye.
Yeah, I mean, that's basically kind of where I was at, because like I feel like I could explain some of the differences that you're seeing from a kinematic standpoint based off of rate deficits and lacking eccentric quadriceps strength. And to me, like that would explain why these people are maybe, they're approaching the change of direction with like that big side bend, or like kind of that drop off of that plant leg. Is like, with the addition of, like a more forward center of mass, like to me, like that is explained more so by there's some sort of biomotor quality somewhere that is contributing to that, as opposed to it's, they're, to me, that makes more sense as to why they may be adopting those strategies. And I don't think that was just addressed to a degree that I would have liked in this paper, because it's kind of showcased as like, oh, well, it's the biomechanical aspects in the way that they're moving. But again, what's contributing to the strategies that they're using? And in my mind, it's rate and eccentric deficits that I feel like was, I don't want to say glossed over, but I don't think that was touched on enough in this paper to kind of support the claims that they were making.
Yeah, I mean, 100%. I'm with you. I would have liked to see eccentric duration, eccentric peak force, or eccentric, just their impulse in general. And then from there, after looking at impulse, maybe reverse engineering and looking at eccentric peak force. And I would imagine their eccentric peak force is lower because if they're spending longer in contact with in the ground, it reduces the demand for those high peak forces. And so they're just dispersing it along a longer continuum, or more degrees of freedom. So, and that is probably because of the fact that, like you said, they just don't have the eccentric capacity, or potentially the eccentric rate of force development necessary to quickly or abruptly halt their negative momentum. So I definitely agree. Maybe, instead of just looking at isokinetic at 60 degrees per second, they should have perhaps also looked at maybe an isometric test would have been beneficial at 60 degrees of knee flexion. And in that way, right, you tell them push as fast and as hard as you can, as opposed to as hard and as fast. And maybe that will reflect a little bit more of like RFD type qualities. So I think something like that could have been maybe more informative.
Still, to get to the making it biomechanics, we almost have to normalize that, right? I mean, if to the point of the paper, which is that the biomechanics are kind of the issue, right? So we have to almost normalize somebody's eccentric issues to be able to say that it's the that it's the biomechanical aspect that's driving the injury risk. Because otherwise, all we have is there's an injury risk when they show this, but is it because of strength, or is it because of the movement strategy itself?
Yeah, it's not like the displayed kinematics are not really what's the issue. It's the lack of, kinetic capacities to complete the task that are just resulting in, this is like a spurious finding, right? Like that's kind of where my head's at with it.
Yeah, that's all the ingredients that they had available to make said recipe. This is all I have. Okay, so that's what they came up with for dinner, right? But if you give them more ingredients, then they can make maybe a better recipe and have a better dinner. So I think it's similar, right? We just have to give them the requisite ingredients to make sure that they have a full meal, or more suitable options available for the task.
Right, and so for the paper to show that it was the biomechanical measures that they were looking at that were the driver, we have to make sure that the recipes are equal. All the ingredients are equal, right? So everybody's got the same ingredients, the same freshness, and then we see if those things still fall out and show that they're a leading indicator for injury. Otherwise, I really don't know what this is. And to me, one of the big questions is, and this goes back to, we keep looking for this predictive validity in sports, right, with our testing. But I hate the term return to play, right? Because we're really just really ruling out people that shouldn't be returning to play, but we're really not able to say, shit, yeah, you're golden, go play. That's not really what these tests are saying, right? And so we're kind of doing a disservice by, hey, it's 9 months and we've checked all the boxes, you're golden. That's not how it works. That's really kind of a return to practice. Right now, you can really start kind of doing some build up to practice and build up to play, because going from 2 to 3 to hell, even in Jared's environment where they may be able to do, 10 hours a week of therapy. How many hours of practice and play are they doing in a week? Right? Have we really built up that load over time to handle that? Probably not. Are they able to produce the forces and things requisite to everybody else that plays that position at that level of sport, so that we know that they're actually ready to compete against those individuals? Probably not. None of our testing is really doing that per se. Maybe when we normalize to body mass with some of the strength, but we don't necessarily know per position. So are we really saying anything other than, no, you're not ready versus yes, you are ready? And I always had that question in mind.
Yeah, I mean, I think the way that I try to phrase that is like, this is kind of like the things that I, at a bare minimum, want you to be able to express to kind of earn the right to like work back into some of these things. Like, I don't think it should be phrased as, like, this is like our gold standard battery that is going to, make sure that this doesn't happen again, because there's certain things that you just can't control. But like, to me, I just try to phrase it as like, this is like the bare minimum that I want you to be able to express and to show, to kind of earn that right to go back. And then whatever happens from there is just kind of remains to be seen. Like, it's always going to be an elevated risk, but yeah,
Right,
I
because
don't
they
think,
probably already were strong enough to play because they were playing, right? They're on the field, they're able to do that. Doesn't necessarily actually mean that they're good movers or that they have the strength. People can be high skilled and not have some of these other requisite qualities and still participate at a high level. But we look at like pro athletes and we keep saying, hey, we need to make you stronger, we need to make you this. Many of those people are strong. Saquon Barkley is strong as hell. Tell me those quads aren't strong, and yet he still blows his ACL. There's some shit that we can't predict, right? So we're just getting a baseline, like you say. I'm trying to make sure that you have some qualities and some affordances to be able to have movement options, but it doesn't mean that we're providing any kind of special armor for anybody. It's just a minimum requisite, and then they really should kind of have some other levels of return before they actually probably playing, in my opinion.
I also feel like for these studies that they don't include a subjective. So for some of the other articles that I've read, when I conducted a systematic review for my undergrad on ACL return to play criteria and the battery of tests, essentially there's like no gold standard for it, even with the limb symmetry index, the biodex, etc. But the main confounding thing that we found with it is the studies that were more predictive of re-injuries for both males and females were the fear of re-injury. Like if they had higher levels of fear with like the Tampa scale of kinesiophobia or those factors, then that had a higher predictive value compared to having weaker limbs or those sorts of things. So with this study, things that I wish I would have been able to see if they would have incorporated at least a subjective component to learn more about the athlete's perspective, as well as getting a table or a chart sheet of what rehabilitative exercises that those athletes can have conducted. Because when they said, oh, they perform physiotherapy for X amount of weeks, for me, I feel like that's not specific enough. And if they were referred out to different clinicians, then it's like, okay, well, are they following it based off of insurance where they cannot get personalized care? Or were they able to go to a clinic where they are able to get personalized care to potentially have better values and a better therapist to improve their confidence levels, thus decreasing their risk for re-injuries and returning back to their sports and returning back to their activity level?
I think they did an ACL RSI and IKDC in this, right?
Yeah, they did.
yeah, they did. They did look at the psychological aspects of it, and it wasn't predictive of, or there was no differences displayed in terms of those that retore and those that didn't.
Right. In fact, we have some data that shows that those that show that they have high confidence have a higher risk of re-tear because it may go back.
Yeah, those are the
earlier
people that make me
and
more
stuff.
nervous. Like,
So there's a
6
mixed
months and I'm
message
ready
on
to
that
go.
as well.
Just be like, pump the brakes a little bit, man.
Could you possibly use this information though, like for individuals who don't have an isokinetic machine and can't measure rate of force, as like if you're not doing these counter movement jumps as part of your exercise and them learning like new movement patterns, because you use it as a way to see like, oh, they performed in that way. They performed the skill in that way. Maybe that shows me that they're not tolerating like rate of force development very well, or I need to incorporate rate of force development exercises based off their performance, like based off of the movement strategies they chose. Like, I guess because if you perform those exercises repeatedly, they might just do them in that pattern. But if you're only testing them every once in a while, could you use it as like, this might be a way where I could assess that? Because like in my clinic, I don't have any way to do it besides isometrically.
You're saying that if we are training them in these capacities, right, or we do a test and we see that they're moving, then that may be an indicator or a proxy for that we need to be working in some of the RF, rate of force development or some of these other kind of things. Is that what you're kind of saying? So if we can't isokinetically test.
Basically, like if I can't test it in the way that would be ideal because of the clinic setup, can I use like these biomechanic problems that, or like different ways that they move that this study proposed as being risk factors? If I see those, can I use that as a way to say like, oh, maybe I need to work on rate of force development so when they land, they don't perform the movement in that way?
I mean, I'd say yes. I mean, we probably all inherently do that. So I'm interested to hear what other people have to think, but I'd be surprised if people would negate that. We inherently kind of reverse engineer when we see things manifest in a certain way, and we try to give a suitable iteration of a tactic that then helps to resolve that decrement in whatever we see, or that aberrant strategy, if you will. So I think you could use it as an imprecise surrogate. I mean, if you're doing counter movement jumps and you see that, for example, they have a longer excursion, which then would prompt you to think, okay, well, that's a longer eccentric duration. They're trying to spread out the forces by using time. So their RFD is going to inherently go down. And so I think absolutely. Now you have to be careful with the cueing, because I think, as you talked about, the cues that you give will manifest as a different type of strategy. So as long as you're relatively consistent, right? If you say land soft versus land stiff on a counter movement jump, then that's going to maybe emerge as a different type of strategy. And so I think you want to be careful in the cues and the verbiage that you give as well. But if you can be somewhat consistent, I think it could give you somewhat of a indicator that's maybe not gold standard, but I think it could still be somewhat useful, and it can help you kind of figure out what is the best strategy or route to go to try to resolve that.
Yeah, I guess the problem would be if I verbally cued someone and they were able to then demonstrate a compensation where they like made up for the lack of eccentric quadricep strength in a different way. But ideally, if I wasn't using it as an exercise or intervention where they're performing it regularly, they wouldn't be able to learn a different strategy. But yeah, obviously the ideal situation would be to actually assess it, but I just don't know how realistic that is in a regular.
Well, to Jared's point, I think the proxy measures are what we all tend to look at. Just what is the quality of a movement when we're doing quantitative measures even, right? And so we're utilizing that as a proxy for what does that actually mean. And if you can cue them out of it, then maybe that's just their chosen strategy. You can wonder why that's their chosen strategy, but and so you can probably constrain an environment to see if you can coerce a certain task technique out of them, right? And then that may drive you towards what you think is a more beneficial strategy. But there's also, when we start looking at, and I don't know where anybody is on their readings, and some people I'm sure are ahead of me, but when we start we're talking about mitochondrial aspects in some of these ACLs that show up, right? And we start getting into some of these weeds where there's real changes, physiologic changes in some of this muscle and some of this other kind of stuff. Some of these strategies may or may not be able to be cued and or trained out of in a realistic short time frame. right? Some of this may be a much longer time frame, and that's where I'm not sure that we have evidence fully yet, but it's kind of confounding those people that are getting good therapy and still aren't doing well. What is it? And some of this may be mitochondrial changes and some of this energy systems within the muscles in and of themselves and the way that their system is responding. And so even if we do the right things and we have those right measures, we're still not always 100% sure of where that is. Kevin, you probably have further read down that rabbit hole than I have.
I'm going to take two. So I think to answer Ann's question is like, yes, I kind of use it as a proxy measure, but I'm more comfortable in using it to tell me that they likely don't have rate of force development as a quality versus like, okay, this looks good today. I feel comfortable in saying that, okay, they do have rate of force development. Like that's a much taller ask to where like, I don't think I would use some of this stuff to, for lack of a better word, like clear that or check that box off, being like, okay, I saw them, you know, they use this strategy in this proxy measure, therefore I'm confident that they have rate abilities. I probably wouldn't use it in that manner, maybe more so as like information to tell you that, okay, this still looks like shit, like they definitely don't have that. That's probably the way that I would go about using it, as opposed to like a clearing marker for that quality, because I just think there's too many degrees of freedom in something like that to where they can kind of hide those things. And then to Paul's kind of last point is, you know, just general time for some of these things to normalize or to restore. I don't think anybody has a good gauge on that. You know, I mean, graft maturation is how long, you know, up to 2 years in some cases. And it's like, is that just something to where like there's going to be these lingering sort of differences among individuals? Probably yes. So I don't know if there's ever going to be a solid kind of point from a rehab side where we can confidently say like yes, this person has normalized back to whatever their pre-injury level was. I think the best we can do is identify things that are preventing them or are limiting them from kind of establishing that certain baseline readiness, whatever you deem that to be, whatever, you know, you've decided good or good enough is. So that's kind of where I'm at with it there.
I do think this is important, why we should say, you know, especially when we're educating, maybe even at the first initial eval, is we're going to go return to, you know, practice, then we're going to go return to and teach it as a spectrum versus once you hit 9 months, once you hit this checkbox, you're clear to go. Because I think setting them up for, hey, listen, you're going to be going from, you know, you're not even, when I clear you to play, it's probably going to be short-sided games 3-on-3, and there's still going to be things that I don't want you to do. When you're cleared to return to competition, that's when, okay, you're full go, whatever. And even then you might, okay, you're going to play 20 minutes or whatever tonight. So I think that's important in terms of like a patient education component, and say like, this is going to be more criteria based, so that once you feel good, once we think that rate's there, explain to them what rate is and why it matters. I think that's a way to get a little bit more patient buy-in, so that they're not bummed and said, hey, listen, you told me I need these 4 things and now you're telling me I don't look good enough. Like, what are you talking about? Because I think that's a good way to shoot ourselves in the foot. Once they hit that, they hit the check boxes, and we say, well, you still don't have this one thing, I still feel off about it. Just being a little more transparent up front is going to help attenuate that if it takes them another month, 2, 3, however long to get rate where we feel like they're changing direction and their counter movement jump is where we want it to be.
Yeah, I agree 100%. And I really like Enda King. He's the lead author on this paper. I think he's doing a lot of awesome stuff. And like, that's one of the things that he kind of talks about consistently is like, you should be able to kind of like before that, the day before that person goes into surgery, like you should have like already written out, like, these are kind of the things that we want you to be able to express. These are the things that we want to be able to see for you to kind of earn that ability to go back. And I think being able to have that discussion, to your point, Matt, like from like day one is like, this is kind of what we can expect this process to look like. These are the things that I want to see you to be able to express and to show to me to kind of earn that there. It at least gives them some sort of game plan and like a roadmap to what the process looks like. But it also helps build trust from like the clinician, or the provider side of point, to where like, if you're just kind of wandering aimlessly and like that approach or that end date is coming closer and closer, and you're like moving the goalposts now, and like this is coming up there, and like you haven't really expressed that from the get-go, I think people lose faith in the process, and that's an instance where the person's more likely to kind of just head back regardless. So you got to have some sort of roadmap and game plan lined out from kind of day one. And I think it's way easier to have that conversation week one post-op versus like rolling into like month 6, 7, 8, whatever it is. And even like the 9-month mark, like I feel like a lot of that's kind of based around an isolated ACL injury, right? We're not even considering, meniscal involvement, chondral damage, those type of things. So, I think it's just kind of reiterates the point that each individual kind of rehabilitation process is going to be very different in terms of timelines, even criteria based on what they're going back to. But if you can have some sort of established benchmark and markers laid out from day one, it'll just facilitate the process in terms of your end and giving you some sort of guidance and structure, and also buy-in, and then keeping them motivated because it's a long haul.
Yeah, Kevin, I'm going to kind of jump into what you just finished up with there. So I think if you really, really boil it down, it's going to be really reductionist here, but it's graded exposure and progressive overload. I mean, whether these biomechanical factors can like actually predict anything, in feasibility wise, we're not going to do that in the clinic anyways. I mean, you can still watch and use the proxy measures, but when it comes down to it, you still just need to, like the counter movement jumps and the drop jumps, those are things you need to do anyways. And whether we can quantify that or not to the best that we can in the clinic setting, you just need to do them. And that can tie into the psychological component too, where if we're repeatedly doing that, they're feeling better and they're feeling more confident in their ability to make the rate of force development. And so I think really just kind of, if you boil it down, I think, it's good that this paper showed this. I think it's interesting. I agree that's not the best paper, but I don't think it's, you have to look at outside of the biomechanics sphere, but you can still apply it clinically, I think.
Yeah, I agree completely. I mean, and I like this paper. Like I said, there's critiques to it, but I mean, I like a lot of what was kind of put here. Like there's things I would change and things that I would have maybe like to see added before they kind of made the claims that they did. One question I did kind of have for you guys is, like, I was thinking about this too, is, let's say we have these individuals that are showcasing these kinematic changes on a change of direction task. How much of that, let's say, like, we'll assume for a moment that they were sufficient in terms of like their quadriceps torque and things like that. What's the possibility of, like, because this person was introduced to change of direction tasks earlier or before some of these things were restored, how much of this is just remnants of strategies that they started to develop when they didn't have sufficient, quadriceps or eccentric strength? Like, that's the gray area for me, is where, like, I never really exactly know when we should start to really work on change of direction. Like, I think there's a large kind of gray area there, to where, like, how much is enough in terms of, peak torque to body weight, RFD measurements, to where, like, okay, like, I think we have a stable base to kind of start to introduce this thing. Where do you guys kind of fall in that sense? And like, change of direction work, let's specifically look at, after an ACL reconstruction, what are some of your minimum criterion that you want to see before you start to introduce some of those elements?
What level? I mean, I may start like small, little, like where they're just doing a jab step and doing some lateral steps and getting ready for cutting mechanisms and stuff very early, right? When are we doing, that control to chaos kind of continuum? I'm starting low impulse, low force, low everything early, right? And so maybe I don't need the same force requirements that I do when I'm having that done at a different time frame, or when we're doing basically, where you're chasing and playing tag or playing chase with somebody and trying to cut and move with them and do some of those things. And so all of those things are at different stages, and it's basically based off of how they've progressed from the early signs and stages. Are they moving what I think is a movement that looks appropriately for that? And to be honest, I don't know of any really great test. We can do all the 505s and all these other kind of tests, but those are all planned, right? So to plan for the pre-plan, I don't know of any good measure for an unplanned, thing, which is true moving from change of direction to how are we reacting, right? How are we actually getting ready for play? I'm not sure that there's a great test. I'd like to see if you have any data. Anybody have anything good on that? because I'm not aware of anything, but it's just basically how they've earned and progressed through from very low level type of jab step, and or if we move from pogos through running or doing any of those other kind of things, what kind of levels are we looking through as we move through, and are they looking good with those and tolerating those, and then we're able to progress through that process, and that's an individual process based off of how they're progressing. I'm not sure I have a true metric. It's just I start early and try to look for what I think is an adequate movement profile for that, and we could all argue what that is and whether or not that's testing well enough, but that's kind of how I progress those.
Yeah, I like that. I think that makes sense. And, I think some of it goes back to a little bit of what Ben said, that a lot of it is graded exposure as well, and looking at do the constrained biomotor tasks, so the strength exercises and its derivatives, coincide with more of the emergent tasks, meaning if someone isn't able to let's say, perform a counter movement jump, or perhaps they haven't progressed to a drop jump, then it probably is, for me at least, an indicator that they aren't ready to perform high entry velocity change of direction maneuvers, because a drop jump is going to have a typically high reactive strength index. And so if they can't show me that, which necessitates rate, they probably wouldn't be in a best position to have a high entry velocity and have to have a high braking moment to decelerate or decrease their momentum. So I think it should be where it's just somewhat of a natural progression of these biomotor qualities and these strength training oriented principles, and they kind of coincide again with more of the emergent, if you will, if we're going to call, change of direction, multidirectional speed, these emergent type tasks, to see if there's anything that can serve a little bit as a proxy or indicator that we can start to progress them, as Paul said, from, more planned or non-reactive to reactive, or true change of direction, progressing to agility. So that's kind of a little bit of how I do it. I'm obviously a little bit more privileged just because of the equipment and technology that we have. So I could be a little bit more specific and get into the weeds on a few things that might be a little bit more representative of the qualities that they need to express in the change of directions. But I think high entry velocities, and then obviously the angles as well, right? So you could start just from 0 to 45 degrees of these cuts, and then you can slowly get up. And we know anything typically over 45, more so 60 degrees, is going to require a higher deceleration force to slow down or break yourself or slow down your momentum. So if I haven't done anything in the weight room that is more of like, quote unquote, strength speed, if you will, then I'm probably not in a suitable position to even do some of those types of tasks.
And Paul, I'm going to go off something you said earlier too. And, we can, you should progress as soon as you can and, as much as you can. But when it comes down to it, when it comes to, contact field sports, we're never going to be able to create in a clinic. And that's just something that, you have to accept. But I think the goal, always should be as close as you possibly can. And as soon as you can, that's still safe. But there's no force you can create in a clinical setting that's a running back getting tackled while making a cut while they're running full speed. You can't recreate that, and that's unpredictable. But I think it's definitely our position. And as Jared kind of said too, that you need to do these high strength speed movements, and you need to get as close as you can to those peak velocities and peak forces in that late stage to prepare for those types of forces they're going to be impacting.
I was so confused on why there wasn't.
Oh, go ahead.
I was so confused on why there still wasn't much difference between the single leg drop jump between legs, because I understood Jared's point. You're dropping from a slightly higher surface, but I don't know if it has something to do with like the use of the calf complex and being able to compensate, because even if the height is still consistent, there should be some variability, or the height is just not tall enough for some sort of velocity, eccentric velocity, to be induced.
As I looked back over that, I don't think they actually used a time component to it. right? They didn't use a reactive strength index. So they had as much time as they needed to actually get the same height on both sides.
Yeah, they didn't look at the time component, I don't think. I believe that they looked at
Just
height
height,
and
right?
just three-dimensional the three-dimensional kinematics on it, I believe. So that's why we were kind of, suggesting that, there's likely some sort of rate deficit there, as like, because like if height was preserved, but they're longer ground contact times. So I don't, if they did have ground contact time metrics, like they were monitoring the time, but I think they were just looking at on it, the kinematics on it. I think, Nick, if I was gonna and Jared, correct me if I'm wrong, I think the difference you were saying there was the eccentric component was going to be less on the single leg drop vertical jump versus the double leg. And that may have been why there was a negligible difference or no difference in terms of like knee flexion angles and distance of center of mass, simply because there was going to be less of an eccentric demand from the single leg versus the double leg. Is that right, Jared? That's kind of what I understood from what you said.
Yeah, that's perfect. You got it. A good paper, single versus double leg counter movement jump test, not half an apple, by Daniel Cohen, is phenomenal. It does a good job at dissecting and trying to discern the differences and the commonalities and maybe the metrics that have more utility. You can make more inferences from, but yeah, I think it has more so to do with the eccentric peak velocity that inherently is higher when we are having both limbs in contact with the ground as opposed to one. And some of that is going to be due to our base of support and center of mass, and that you just wouldn't go lower on one limb compared to two, because your base of support now is also broader. But you can develop more velocity when both limbs are in contact with the ground. So that probably will manifest as different performance outputs.
And then Jason, did you say that they didn't look at a time component for the single leg or the double leg?
I think they did for the double leg. I didn't see it. Yeah, they definitely have ground contact time for double leg. I didn't see it for the single leg.
Yeah, that's so. I mean, maybe this is just something again where like it doesn't make sense in their data to where like, because did they even biomechanically analyze this thing? Now that I'm looking, are you looking at table 5?
I was looking at table. Well, yeah, table 4 and table 5. Table 4 is just the actual height values, and then
Yeah,
table
and, like,
5 is they have a few things on double leg drop jump and plan change of direction.
Yeah. So did they even look at the biomechanics of the single leg, or was that strictly just a centimeters in height?
If it was just height, then that's the answer.
Yeah, that could be it. Oh no, it says that they did here. So groups did not significantly differ for any variable within the single leg drop jump under biomechanical analysis underneath figure 2. I still don't understand that one. I think maybe Jared's got the answer though.
Yeah, and then I just wonder what they say, no biomechanical variable, and it's like, well, which which metrics did you actually look at? You know, a lot of people,
Yeah.
they might not look at eccentric peak velocity or the eccentric unweighting phase, and you know what I mean? So it's because there's just so many metrics that the force plate will spit out at you. And so some of them you kind of disregard as being relevant or influential in the movement. So that would be very enlightening to know.
Now, Jared, I'm going to ask you, what do you find relevant in your work? What with the force plates do you find most relevant in like a counter movement jump and some of those things for what you're looking for with your athletes?
Good question. I would say, I mean, I am more towards obviously the reconditioning rehab aspect and less concerned with the performance outputs, meaning things like jump height or concentric peak force, maybe RSI can still give you a good, decent indicator of a tissue readiness somewhat with a dynamic task like a counter movement jump. But in general, I would say I would delineate it in regard to looking at readiness by you have strategy and then you have more so capacity. So the way I kind of define strategy is just the demonstration of confidence and tolerance to subject your extremity, or more so the knee. We'll just take the knee in this example. So that it's pre-injury kinetic strategies. And then capacity I would define as like the demonstration of decelerative force generating capabilities that are reflective of the kinetic capacity. So if we look at strategy, I care more about eccentric peak velocity, counter movement depth, and then eccentric duration. Again, this is more so for if we're looking specifically at the knee, but also it could be beneficial for, let's say, some type of an ankle-oriented injury as well. And so eccentric peak velocity to me is important because I'm thinking about, hey, is there resolution of downward velocity because this requires greater deceleration forces. So I want to ensure that we're testing the brakes after pushing the car to its high speed, right? We might test the brakes but not really push the gas and get a false positive that, oh, the brakes are solid, but we actually didn't test the brakes at high velocity. And so I think that making sure eccentric peak velocity is restored is incredibly important because it can muddy some of the subsequent metrics. Counter movement depth, I think, is important, making sure that they have like this restitution of external knee flexion moment tolerance, but not necessarily like Kevin talked about at the expense of eccentric duration, because sometimes they get this counter movement depth, but they're doing so because they're trying to stay in contact with the ground for longer, so they go through more excursions. So I'm just making sure, do they have restitution and is it near their pre-injury values? And then their eccentric duration for strategy is the last thing, and probably a really important one, I think, that gives you a lot of good information. And that's just making sure they're not extending like this eccentric time to minimize the braking force that's required. And then you can look on the capacity side. I'll look at like eccentric deceleration impulse asymmetry. I'll just look at their absolute eccentric deceleration impulse and then their eccentric peak force. And so all those things I'm looking at to make sure they have that maximal mechanical force during the eccentric phase, or make sure that for the eccentric deceleration impulse asymmetry, they have a resolution in the injured limb deceleration, and they're not avoiding load and offloading it, which that's one reason why I like a counter movement jump, sometimes even more than a single leg jump, because they have the opportunity to show you a different strategy and solution. If it is available, will they choose that route? And so that can give you a good idea of a particular tissue's readiness. And those are kind of like the big things that I look at. Obviously, there's others. I don't think RSI is bad, but these are just the ones I like. Jump height, I definitely don't use, but if I were to use it, I would make sure I reverse engineer and look at eccentric duration, just to make sure that, again, they aren't staying in contact with the ground longer in order to achieve said jump height or eccentric peak force. I would look there as well. I know that's a lot, but it's just
I appreciate
the main
that.
things I look at.
Do you do that just in the vertical, or do you also do like looking at the penultimate step or anything that for kind of the horizontal force as well?
Yeah, we're starting to look at that a lot, timing gates and breaking it down and doing kilograms and things of that nature, and kind of seeing.
Yeah, you get to play with all the toys.
The kind of
I'm just jealous.
yeah. So it's yeah, definitely privileged there. But yeah, you could definitely do that. But I'll be honest, like a lot of times when you do those things, you kind of you see an expression similar to what we're talking about with this paper of certain strategies, and then you reverse engineer and look at some of the constrained data. And to Kevin's point, I mean, it just makes sense in regard to what you've tested on other types of technologies. They'll manifest themselves in emergent ways. So yeah, you don't always need those things, but it's fun to look at and be able to, kind of map out a picture, paint a picture.
Do you get lost in the data?
I think I would say no, but I think that it's okay to sometimes, as long as you're not trying to make specific assertions or interventions based off of getting lost in the data. Meaning, I think you have to get lost in things, whether it's data or a new type of information that comes out or knowledge that you're acquiring. Now I'm on a diatribe right now, sorry, but it's just like, yeah, I think it's okay to get lost in things, to like fully try to grasp it and understand it a little bit, and then you can kind of pull yourselves out the weeds. But it's hard to really reflect, for one, and compare and contrast if you don't give yourself the opportunity to kind of get lost for a little bit.
Yeah, but that's learning curve. You're in a big data world. I just didn't know, do they actually know what data matters now? Or for a while there, they were just wondering, what the hell do we make of all this shit?
Yeah, I think yeah, that's a great question. I think it's just you continue to learn, right? You try to put things together. It's so much information that's available. And it is easy to get lost and to make pivots when you maybe don't need to, and measure
That's
things
where
that
your principles come in,
be
right?
meaningful. Yeah, exactly.
All right, cool.
Jared, one last question. Are you able to use like the force plates and do repeated counter movement jumps just to see if there's a drop in like eccentric impulse or something, like some sort of statistic like that? Obviously.
Sorry, I broke up a little bit. Can you say that one more time? I apologize.
Yeah. So could you use the force plates and do some sort of like 5-time repeated counter movement jump to see if there's like a huge drop off in their ability to absorb eccentrically and quickly, like the rate of force development or something like that? Obviously there's going to be a drop off, but I don't know if there's a way to kind of see something significant, because that would be looking at some of the conditioning abilities of them to continuously put out the same force, especially if it's like a basketball player who's going up for multiple rebounds.
Yeah, that's a great question. I think there are a few different things that you could do. I would say that you would probably want to do a longer duration repeated jump test. I want to say Matt Jordan has a 80-second jump test, one jump performed every 4 seconds for a total of 20 jumps. And I believe he takes the last 5 and the first 5 and looks at the asymmetry between those. And sometimes what you will actually see is not necessarily an increase in an asymmetry, but you will see a decrease in the asymmetry. And typically that happens because the non-injured or non-surgical limb has had to do more throughout the 80 seconds. And so as a result, it becomes fatigue. And now you see closing of the gap between the limbs. And so that's still reflective of, well, the surgical limb needs to improve its repeated force generating capabilities. So that's one test. Again, that's Matt Jordan. Highly recommend his work as well. But it's the 80-second jump test, one jump or counter movement jump performed every 4 seconds for a total of 20. I forget the specific calculation, but I would say that's probably a better reflection of someone's kind of bioenergetic, if you will, capacities.
Yeah, I would second that. I'm deep in Matt Jordan's stuff right now. I'm like over my head here. I'm just like swimming in all sorts of stuff. So Would second that. Shout out to Matt Jordan. Anybody else have any thoughts on this paper? Nothing. All right. Well, I will say they did do, so there's a follow-up paper from the same cohort from Andy King's group where they were looking at contralateral injury. So I would definitely recommend you guys take a look at that one as well. More kind of interesting data regarding that. And otherwise, I think that's about pretty much wraps it up. Unless anybody else has got anything else to kind of add or what they want to float out there.
I did drop the post-meeting survey in the chat, so if you guys wouldn't mind clicking on that before you hop off, just so any feedback that you give us, we always take that to account with all these meetings. And then also, if you're not part of the CALU Facebook group, I can drop that link in too. You should be. That's where we kind of drop more questions and help each other out there.
Also in the post-meeting survey, if you just like want me to not do this anymore, that's where you guys can kind of get your shots in there. So thanks again for Megan for having me. It was fun.
Yeah, absolutely. Thank you, Kevin. All right. Well, everyone, have a great Monday night and we'll catch you next month.
Appreciate it.
Thank you all.
Thank you both.